Welcome back to Going Walkabout. It's funny that there is no book that you can read to tell you how to deal with all the things you're going to have to do as you age. Things like decisions on Social Security and Medicare top the list. When should I take Social Security? And does Medicare cover me if I go overseas? In this video, I will try to cover the process that I went through when I got my Social Security at 63 and then when I got Medicare at 65. Before we get started, I do want to make a disclaimer. I am not an expert on either one of these programs. There are experts out there, and a little further into the video, I'm going to be putting up 1-800 numbers for each of them that you can call if you have questions or you want a more in-depth discussion on the subject. This video is really about my process of what I did as I got these different programs started. And my hope here is that this might help you determining maybe some of the decisions that you'd like to make as you start delving into these two programs. Let's start with Social Security. One of the first things you're going to want to do, if you haven't already, is go to ss.gov, that's socialsecurity.gov, and set up an account. Now, I actually did this when I was 55, around there, because I didn't want to keep getting those paper statements in the mail. And when you set up your account, you'll be able to then get everything electronically, which is really nice. And I'm going to kind of go through that whole process right here. I'll run through a step-by-step process here. Go to ssa.gov. I found the process very easy, so don't be intimidated. Once you sign up, you'll have your own portal. As you can see, you can view statements, replace a card. It's a great portal and easy to use. This will also be important as you can manage payments to Medicare from this portal as well. I'll be going over more details on Medicare shortly. However, it's great to see you can manage everything from here. Please refer to the experts for more info. Here are the 1-800 numbers. Okay, you've now set up your account and you're doing everything online. And you're close to turning 62. So you have to determine, are you going to take Social Security? This is a very personal decision. And as you can see by the scale that I have over here, the amount that you get does change depending on the age that you start taking Social Security at. So again, make sure you view all of that information before you make your decision. So I retired at 63 and I decided to take Social Security right at that age. And it was really funny. It's kind of like hindsight is 20/20. I was so glad that I ended up doing that. And the reason is because once you retire, you actually do miss that paycheck that you've been getting every week or every other week over the last 40 years. And I certainly noticed it when I wasn't getting those paychecks anymore. So literally starting my Social Security checks exactly when I stopped work made it feel like I still had money coming in. And for me, that gave me a feeling of confidence. And I would just say to anybody that that might be a smoother transition than the cold turkey of not having anything coming in anymore. So do think about that. That's something that has really worked well for me. So when you're nearing the time that you're going to get Social Security, you're going to want to call the Social Security office, talk to somebody. I never actually went into the office. I did everything online and via the telephone, but I was able to set up direct deposit, which I highly recommend because that has allowed us the ability to be anywhere in the world and still receive our Social Security every Wednesday. It's usually the second Wednesday of every month, and it's like clockwork, and it's a wonderful thing to be able to depend on that and have it go immediately into your personal bank account. One of the things I want to share with you that I was shocked or interested in to find out as I was going through the process of getting my Social Security is that if you work, and let's say your spouse is a homemaker, and that is for the majority of your marriage, it needs to be for at least 10 years, then your spouse will automatically get half of whatever your Social Security is. So let's just say I was to get $3,000 a month, then even if my spouse never paid into Social Security because they hadn't worked, they will still get $1,500 a month So the total for your household would be $4,500 a month. And I thought that was pretty cool. So when you are getting Social Security, if you've been married for over 10 years, your spouse is entitled to your benefits. So make sure they sign up at the same time. In our case, we got both of our Social Securities turned on at the same time and both deposited in our account at the same time. And again, because I quit work and there was no paycheck coming in, that was really a nice transition and made things a lot easier for us financially. So you've logged on and you've set yourself up online. Really important to do. You've then got Social Security and you're getting paid direct deposit, which is wonderful. The next thing that platform is important for is because that is where you're going to be managing your Medicare from. And you're going to be making payments into Medicare. So now we're going to go to the part 2 of this presentation, which is talking about Medicare and some decisions that we made in regards to that. So Medicare is a much bigger animal in as much as there are very exact rules for it. There's rules for when you sign up. You can do so a month or 2 months before your actual turning 65. And then I think you can actually start taking advantage of the benefits a month before your birthday, your 65th birthday, which is kind of cool. But you're going to want to talk to somebody who is a professional. And again, I have put the 1-800 numbers up on that. I highly recommend talking to a specialist because there's 4 different parts to Medicare. There's A, B, C, and D. And you're going to be making decisions on those things. It's also important to know that Medicare isn't free. You do pay for it, thus setting everything up in the Social Security platform, because you can have your Medicare paid for directly out of your Social Security account. And that's what we have done. Now, as I've said, there's a cost to Medicare. And the only part of it that can be free is Medicare A. And it can be free if you've worked for 10 years or 40 cycles. And again, if you've done that, that can then be transferred over to your spouse as well. So for instance, my husband was a contractor. He didn't pay into the system for that long of time, but he was able to get the Medicare A at no charge because I had paid into the system for way over 10 years and 40 cycles. So those are the type of things that you need to understand. Now, as I mentioned, there is a cost to Part B, C, and D. We personally only have B and D, and the cost of those 2 for both of us is less than $375 a month. For everybody, it's going to be slightly different, but $375 a month seems very reasonable to me for getting all of the things that you see. I'll put them over here on this chart of what Medicare A, B, C, and D is. So we feel that that really works well for us at this stage of our lives. And as I mentioned a little earlier, I said that you can set it up so that your Medicare is paid out of your Social Security account. We did that so that we don't have to worry about missing a payment or something like that because we are traveling full time and we have been for 3 years. So I can tell you that that has worked out really well. And as I showed you previously on the whole kind of setup that I did for Social Security and Medicare, you'll actually see the payments that you're making coming out of the account if you want to look at that all the time. We don't, but that's how all of it works. So it actually works really well. And then it doesn't need a lot of attention from you as you're doing other things like traveling around or possibly living in a different country. So that's actually a good segue because the question I get a lot is, can you use Medicare overseas? And the short answer is, no, you can't. So this plays into me explaining what we've decided to do. And again, this is a very personal decision. Everybody needs to kind of do their own research and decide what would be best for them. But for us, we felt that the Medicare would be a good backstop. We weren't in the country. We weren't going to be in America. We'd be in other countries. Most of the other countries we're going to have socialized medicine, so it's actually pretty inexpensive if you need to get something taken care of. But what we figured is if something bigger came up, we would come back to the United States and take advantage of Medicare. Now, that actually did happen this last year. My husband had a really bad hip, and the poor guy had dealt with it for several years, and it finally got to the point where he said, gosh, I've got to get this taken care of. So we came back to California and stayed in California for 4 months, and he had the hip operation. I will tell you that had we not had Medicare take care of this, it would have cost $47,000 for him to have the hip operation. With Medicare, we literally paid zero, absolutely zero. And I will say, outstanding doctors, outstanding hospital. He was walking the first day, which was mind-blowing considering the pain he had been in, and he's now doing terrific. But we think that Medicare is really good to keep, and we pay into it for that. Not to mention the fact that I paid into it for over 50 years of working, so I felt pretty excited that we were able to take advantage of this program that we had worked really hard to pay into for all those years. And it actually worked really well. So in that regard, that is why we keep Medicare, regardless of the fact that we're very rarely in the United States. It works well for us. So the next question I get is, will you keep Medicare if you move permanently to another location, country, whatever? And at this juncture, we are looking at keeping our Medicare. It is most likely that we will settle full-time in Mexico. And with that being the case, it's a pretty quick plane trip to get back to California, where our providing is being done for Medicare. So we think we will probably keep it. Now, with that said, I will tell you that in many countries that you move to, you can get the equivalent of Medicare type services for most likely what you're paying for Medicare. As I mentioned to you, we're paying less than $375 for the two of us per month. There's a very good chance that in many countries that you go to, you can get full health insurance with coverage for pretty much everything for about that same price. So at that juncture, you might want to not keep your Medicare. That's completely, as I've said many times, a personal decision. But at this juncture, we're going to go ahead and keep it. And I must add, they did an outstanding job. Up to this point, we've been very happy with it. I guess the last thing I want to talk about is something that is a lot of people who haven't traveled a lot may not be aware of. And that's that healthcare and pharmaceuticals or drugs are a lot less expensive in other countries. In fact, the difference can be 50 to 75% less. So our healthcare is extremely high. Our health insurance is extremely high. Other countries do not have those same things. Just recently, they had the CEO for the product Ozempic that was in the Senate. And the Senate was saying, why are we being charged $1,400 per device? And you could go to France or Germany and you would only be paying $30. And don't quote me on those exact prices, but the difference was that enormous. And so what we have found over the years is that for certain things, we literally go to Mexico. Now, you're going to find if you get Medicare that dental is not covered under Medicare. So for the last few years, when we were living in California, we would drive to a place called Algodones. And Algodones is on the border of Mexico and Yuma, Arizona. And in Algodones, they have literally hundreds of pharmacies that are selling all of these drugs that we pay enormous prices for in the United States. They're literally selling them for 75% less. And you can get outstanding dental care there, which is what we've done for probably the past 6 years now. And again, most of the dentists are trained in the United States. and then they work in Algodonis, and they do a great service. I'm going to show you some of the video of where we go to get our teeth done. And so once you start traveling, you start realizing that there are ways to leverage geo arbitrage. And what that means is you've made your money in Canada or you've made your money in the United States, and you're going to spend it in a place where it goes a lot further. So for instance, a normal procedure, dental procedure, checkup and whatever, where I lived in Palm Desert could be as high as $1,000. In Algodonis, it would be about $120. And absolutely the same level of professionalism and quality and everything. So do check into some of those things. It's really well worth it trying to make your money go further. So hopefully that's helped answer a couple questions about Social Security and Medicare. I know I got a boatload of questions from the last video I did last week. I'll put a picture of it up over here. And please keep the comments coming, keep the questions coming. I want to thank all of you who have subscribed. I really appreciate it. And I really appreciate all the feedback and comments too. And for those of you that enjoyed this video, a thumbs up would be greatly appreciated. It really helps the channel. Or better yet, subscribe. We do a new video every week. Thanks so much, and cheers for now.